The reason I wanted to be in Bend was to really focus on what it means for rural Oregonians to access the care they need, how long it takes them to get to care, what their providers on the ground are working on every single day to provide care. And I really want to thank everyone behind me here today, our family caregivers, our doctors, folks who run clinics, folks who run hospitals, folks who run the coordinated care organization that provide the Oregon Health Plan here in the state of Oregon. We are here because Republicans in Congress are trying to cut very important programs for Oregonians. Medicaid program, the SNAP program, is a lifeline for Oregonians. I heard that from folks at this roundtable. I would like every member of Congress, particularly Republicans in Congress, who are pushing budget proposals that would cut Medicaid and SNAP, to sit across the table from the folks I talked with today. Family caregivers who are absolutely tied to the Medicaid benefits that they get through the Oregon Health Plan to make sure their kids can have what they need in their homes. The most cost-effective, best way to provide care for children with special needs. We're doing that here in Oregon. It's not easy, but we're doing it. Cuts in Congress will make that impossible to continue. And children are going to be hurt, families are going to be hurt, and I think we will lose lives in our state if those cuts go through. When we talk about food assistance, I heard from folks today who work in rural communities making sure people can put food on the table. When SNAP benefits are cut, that affects the grocery store where people use them. It affects what people can put on their table. That is taking food out of the mouths of children and seniors and our veterans who depend on SNAP benefits. What we're seeing from Congress is a cruel and unnecessary plan to pull money, our tax dollars that we send to D.C., taking it back to D.C. to pay for tax cuts for very wealthy individuals, instead of letting those dollars come back to the state of Oregon to provide benefits through the Oregon Health Plan and through SNAP. They are cutting things that will make our communities unhealthy. And one of the things I heard about today was the providers. We have been so fortunate here in Oregon because we have been creative, we have all worked together. 97% of Oregonians today have access to health insurance. And a large number of those, over 1 million of them, are on the Oregon Health Plan. Because we have so many people covered, we have rural hospitals, we have rural providers, we have folks that, even though it's hard to provide OBGYN and delivery care in rural communities, they are there, they're making it work, because we have said, let us invest in our families and our children and our seniors so everyone can have care in our state. That is all at risk right now. And one of the reasons I'm also in Central Oregon is, Congressional District 2, which encompasses most of Eastern Oregon, is one of those places in the state where there is a large need for food assistance and health insurance through the Oregon Health Plan. In fact, Congressional District 2, represented by Congressman Cliff Benz, has the highest reliance on the Oregon Health Plan and SNAP in the state per capita. There are 166,000 Oregonians who depend on SNAP here in the eastern part of the state. And 70% of children in rural areas receive their health care through the Oregon Health Plan. This is going to affect every part of our state if these cuts go through. But mostly, our rural and frontier areas are going to be devastated. We will lose hospitals, we will lose providers, and most importantly, people are going to suffer because of these cuts. One of the things I learned today was, when we are talking about these cuts, what you hear from Washington, D.C., that this is bureaucratic bloat that we need to cut. We know how to run cost-effective, effective programs in the state of Oregon. This is not bureaucratic bloat. When and if the Medicaid program is cut, the people behind me, whether it's their families or their providers, they will see the devastation from those cuts. And it is unnecessary. Let's invest in our communities. This isn't about tax breaks for the ultra-wealthy. This is about what we do for our state. And frankly, Oregon is doing it well. We want to be left alone. We want to be able to have these resources, come into our communities and serve people as best we can. And that is all at risk right now with what is being proposed in Congress. So with that, before I take some questions, I would like to yield the podium here to the Director of Mosaic Health, who will also share some thoughts.
Thank you, Governor Kotek. I'm Megan Hayes. I'm a family nurse practitioner and CEO at Mosaic Community Health. We're a nonprofit community health center that has 16 sites across Central Oregon. I am deeply concerned about the potential impacts that proposed cuts to Medicaid would have on our patients and community, as Governor Kotek shared. More than half of our 34,000 patients rely on Medicaid coverage, and this coverage allows our community members to receive essential healthcare services and preventative care that helps keep them engaged and contributing to our community, whether it's through work, education, or being caregivers for their families, as we heard today. Without Medicaid, many people will be forced to avoid or delay seeking help for healthcare needs, resulting in declining health and eventual healthcare crisis that leads to hospital stays and poor health outcomes. This actually costs taxpayers more money in the long term. One of our doctors from Burns shared today, diabetics who do not have access to primary care and getting their condition treated, their health declines, and what happens when their health declines, they end up in a hospital with severe complications that are incredibly expensive to treat without any payment for that. With the proposed Medicaid cuts, community health centers like Mosaic and hospitals that serve little communities are in danger of reducing services or even closure, forcing people to travel large distances for care while also impacting our local economies and eliminating critical jobs. Medicaid cuts would take us further from, not closer to, our goal in Oregon to have healthier communities. Thank you.
Great. Now we have just a little bit of time for some questions. We have about 5 minutes. Sorry, we have to keep things moving a little bit. Just some ground rules. I will take questions first from in person, and then we'll see if we'll have remote questions that we'll take as well. But we are going to be prioritizing questions about this event. Questions first in the room?
Yes. Governor, you heard that the economic impact of this, goes beyond those who are on Medicaid, SNAP, OHP. Talk a little bit about that.
Yeah, thank you for that question. Remember that our healthcare providers are employers. When someone is looking to build a business or start a business or keep a business, they want to know if there's healthcare in that community. So if we lose or see substantial reductions in our hospital care or primary care, that will affect the entire economy in an area. And we will see, I think, job cuts. We will see businesses close because they will not have the services they need, particularly in rural and frontier areas. So this is an economic issue for the state of Oregon. And I think right now, when the cost of living is so present in people's minds, the cost of food, the cost of health care, this is not the time to cut. This is the time to invest. And there will be impact on our economies. Less money in the grocery store if you don't have your SNAP benefits. We could see grocery stores closing or significantly reducing the supplies that they have. That is just one instance of why this has large impact, not just for the individuals who are receiving the care or the assistance, but all of us. And it's a really big deal. And I think it's just frankly not smart economic policy.
Virtual question about what's being discussed here? Okay. Go ahead.
I'm Joanna with the Source Weekly, and you mentioned that these cuts would require the state to pick up some of the slack when it comes to assistance with Medicaid or SNAP. What would that look like at the state level, and what are some impacts that could come along with filling that gap?
Well, let's talk about the Oregon Health Plan first. Right now, there are a lot of individuals who receive help through the Oregon Health Plan who are caregivers, taking care of family members. These aren't individuals who need to be out working. They're there to take care of family members. So we hear about this work requirement a lot from Congress, that we need to have work requirements for people on the health plan. If you're not at home taking care of someone, you are most likely working. So people are already working. But when you put an extra hoop you have to jump through to prove that, people get busy, life intervenes, we will have people lose their care because they didn't get their paperwork in or something happened. That is not on them. We are trying to make it easier to keep people having their care. To implement the work eligibility that we're hearing from Congress, it's going to take a while, but it's going to cost upwards of $100 million between the staff and the programming changes on our eligibility system just to make it happen. And what I heard from the providers today when we were talking about it, we know people are just not going to keep their care, because the harder you make it, the fewer people stay on. That's how Congress is playing to save money. It's not budgetary efficiencies. It's actually kicking people off the program by making it hard to stay on. When it comes to SNAP, right now this is a state and federal partnership. 50% of the administrative costs of the very complex program are covered by the state, so we have skin in the game, and then 50% is picked up by the federal government. They want to change that percentage, put more of the administrative burden on us, which costs money. Then they want to say, you should pick up more of the cost of the food benefit. Right now, 100% of the food benefit, which anyone on staff knows is not exactly luxurious, the federal government pays for that. They want to put more of that back on the state, and right now, we're looking at changes being proposed of adding another $850 million back onto the backs of Oregonians every 2 years to pay for those SNAP changes. We don't have the money here to do that. Federal government needs to stay committed to paying for the benefits and sharing the burden of the administrative costs.
Virtual question about what's being discussed here? Great. Other questions in the room? Other media? Follow-ups? Let's take the virtual question.
All right, Governor, question from K2. Lawmakers are now proposing a tax on oral nicotine to fund wildfire prevention. Is this something you support?
I do think we should tax nicotine products, and we're talking about the types of new products that have nothing to do with smoking. They're about pouches in your mouth. That is a highly addictive substance, and I do think it should be taxed.
Other questions? No more follow-ups?
Sure.
Yeah.
At the very end, you said you were feeling angry about what you were hearing. What specifically made you angry of this roundtable in particular, the stories?
I appreciate that. What really makes me angry about this is it's how unnecessary it is. Like I said, we have people who every day show up to help their families, to help their communities, to provide health care and food assistance. It is not easy, but we are managing to make it work here in the state of Oregon. States have to be able to run their own programs and do what they need to do for their states. And here in Oregon, we know how to do it. And what I'm hearing from Congress is, we want to tell you how to do your job. We want to take your federal tax dollars. We want you to hurt your residents because we want to give major tax breaks for really, really wealthy people. That's just wrong. It's cruel. It's mean. And where I got mad today is I'm listening to folks who are struggling every day to serve their families and serve their communities. And what our federal government should be doing is frankly making this easier. These proposals out of Congress are ill-advised. I think they're immoral. They are not going to help our state. And I am going to shout from the rooftops for those folks in D.C. to say, don't do this. Leave us alone. This is not what you were elected to do, and I hope they hear us. So thank you.
Great. No more questions? Perfect. Thanks, everyone.
Thanks, everyone. I really can't thank you enough. Thank you. Thank you. We appreciate it. Right back at you. Thanks, everyone.